I want to touch on providing an update on the coronavirus first. And we do have David Gonzalez, who's the director of the health department, who's here. And so he's going to spearhead this update. We also have our emergency management coordinator, Rick McBriar, and our fire chief, Chief Fox, here as well to support him and help answer any questions that you might have. So, David?
Good. Thank you, City Manager. Good evening, council and staff. Just asked to present a current update. We'll just give some very kind of general situational report and then be happy to answer any questions, then kind of defer to Rick and Chief Fox for some further statements from them. Just so you know, currently we're monitoring national situation. It's evolving on a day-to-day basis. Currently, we're looking at about 100 cases in the U.S. right now. The CDC is dividing that up into two categories. One is going to be essentially cases that originated somewhat in the U.S., and there's about 60 of those. And then they have about 45 that came over on from the cruise ship that they repatriated here to the U.S. So we're looking at about 100 cases. That does change on a daily basis, so those numbers will change in the coming days. Right now we're looking, I believe there's been 6 deaths nationwide. 4 of those were in a nursing home, and I believe all of them have had underlying conditions. So we're looking, those here locally or in the U.S. have been attributed somewhat to those cases of underlying conditions. If you may have heard that there was one case in Texas that tested positive after their release from federal quarantine, and those are those were the cases that were under CDC monitoring there at Lackland. So you may have heard that in the media. CDC is heading that effort up to do the contact tracing there with that individual. And they are currently heading up a situation in coordination also with San Antonio Metro Health Department and DSHS Region 8 and the Department of State Health Services as well. You also may have heard the San Antonio mayor declared a public health emergency there. From what I've learned, most of that is due to the resource, I guess, needs there locally and within the region that due to the investigations and the support there for Lackland, as well as the exposure there they had locally. So that's where the primary need for that declaration came from. Right now, just so you know, with the Victoria County Public Health Department, we're referring to CDC for guidance as well as Department of State Health Services on guidance for the situation. We are coordinating both with all with the Office of Emergency Management, Victoria Fire Department, EMS, school districts, hospitals, higher education, through to kind of head this up for a coordinated effort there. We will continue to share information as it comes available. We share it both through our primarily through our Facebook at the health department, our website, and then we also push it out and share with the city and county also to push out to their social media and other media sources. We've had questions regarding signage and information from the public and businesses. We're happy to refer those out to the CDC website for those. We don't have anything materials developed for that. But CDC has an abundance of resources on their website that the community can defer and refer to them. Just so you know, we've been working with command staff and the Office of Emergency Management and, like I said, hospitals, EMS to develop plans, and we have plans for monitoring possible cases, and that we do have one at some point within Victoria County. And we also can continue to develop and adapt plans because it's an ever-changing situation, as you know, from day to day. You've heard new information come out, new reports, so we're trying to evolve as quick as possible to address those needs as they arise. A couple things just want to kind of advise. Did issue a press release last week that was pushed out to local media. Just a couple of important talking points on there I wanted to go over. Just keep in mind, for the general American public at this time, again, this could change very rapidly. You know, the immediate health risk from COVID-19, novel coronavirus, is considered low. But again, that could change on a weekly or daily basis. What's important to know is the way it's transferred and transmitted, so that helps to learn how you can prevent from being exposed from that as well. Primarily between people who are in close contact with one another, so within 6 feet, And usually it's spread via respiratory droplets produced when you're coughing or sneezing, which in turn land in the mouths and noses and things. That's why we're encouraging hand washing, use of a hand sanitizer. Keep your hands away from your mouth. If you're sneezing or coughing, sneeze or cough in the sleeve, not in your hands to help prevent that spread. Keep in mind there's no current vaccine. I know they've developed, but vaccine development takes a long time. So with this current situation, I don't know if it want to be available. So really the important part to remember is that it's up to the community and the public to help slow this spread and to stop it eventually. And that's just with, obviously those hygiene recommendations, washing your hands, avoid touching your face. If you're sick, stay home. If you know someone that's sick, avoid them, try to stay away from them. Clean, disinfect surfaces if you are ill. If there's places that are, that's exposed to the public a lot, please keep in mind, clean, disinfect those surfaces around there as well. Again, the greatest asset really to slow this spread is going to be community effort. It's not, anything that one of or two of us are going to do with plans. Is really community effort. Just same as flu precautions, help stop the spread of flu with those general guidelines that I discussed. For more information, again, CDC website, Center for Disease Control at cdc.gov, Department of State Health Services, and then also Victoria County Public Health Department website and Facebook. We'll continue to push out information as it becomes available, and we are available to answer any questions if you have them. I'll defer to Chief Fox and Rick. You have anything?
Good evening once again. Mr. Gonzalez summed the big picture up very well, but I kind of we wanted to address council and let you know what the city of Victoria and their staff are doing and preparation for the coronavirus. If Chief Craig doesn't mind, I'll speak for PD as well. Kind of what we've done so far, and we've been working on this for weeks. This just didn't happen the other day. Dispatch protocols have been adjusted to, and this is all about early screening, so we've already adjusted our dispatch protocols and screening techniques. We've also adjusted our patient interrogation questions. When we go to scene, we're actively trying to screen those patients out and identify them early. All first responders have reviewed our highly infectious disease policy. We do that training every year. The one good thing about the Ebola crisis was it prepared us for following crisis like this, so we're very well prepared. We're also evaluating our PPE. David mentioned that, kind of the crisis in San Antonio. Being a fire service, that was kind of beneficial even in the Ebola crisis. We have alternative respiratory protection measures, and we do have that here in Victoria. So we're going through inventorying our PPE and also identifying other sources that we could use if we are unable to obtain PPE. And lastly, as Mr. Gonzalez and Mr. McBriar will say, is that we're staying in constant contact and always updating our plans and evaluating the situation. I'd be happy to answer any questions regarding the city's actions.
I'll just briefly add to the city's actions
Yes,
that
sir.
we're also having conversations with HR from a risk management standpoint, just so that we're proactive and prepared to address any particular issue if there's an issue with an employee or somebody that visits one of our city facilities. And so that's something that we're proactively having meetings about as well, just so we at least don't go into it completely blindsided if something comes up. Rick, did you want to add anything, or David?
I think the only thing that needs to be added is that there is constant coordination with our hospital care facilities here in Victoria. We have a very unique group that meets on a regular basis, the Hospital Planning Group, the Healthcare Coalition, and they're all in check with each other. Those plans have been developed for years and are constantly looked at, and that group is a highly coordinated group. And so as information comes out from the epidemiologist and or from David's staff, we make sure it gets pushed down to them, and there's a two-way street of communications. And so that is an ongoing effort that we have on everything that we do. So we'll be happy to answer any questions. Or
Yeah, I just want to add one more thing. We're anticipating possible cases in Texas. There's really nothing to prevent it right now. It's in the U.S., so that's what we're preparing for. Of course, I mean, currently there's no confirmed cases in Victoria County. We can't report that, but definitely we're preparing for, I guess, cases in Texas at some point. So just want to add that.
And I'll also add too that one of the things that we're trying to be consistent with is referring everybody to the health department and to get their information from the health department. It's important that we're all on the same page with where the information is coming from. And in our particular case, it's from the health department. And so if somebody does ask any one of us, who do I need to follow to stay up to date? The answer is the health department.